Good afternoon, everyone. Thank you for being here and thank you for joining us for this webinar on fire and life safety for seniors and older adults. My name is Jasvinder Channa and I'm the Executive Director of the Senior Strategic Planning Branch within the Seniors Division of the Ministry of Seniors, Community and Social Services. So it's a priority of the government of Alberta for seniors to age in place. So part of aging safely in one's home and their communities, just to make sure that our homes and our homes are safe and that we're all prepared in case of an emergency. This is why today I'm very pleased to be joined by some subject matter experts during Fire Prevention Week 2024 to discuss fire and life safety, specifically looking at special considerations for older adults, seniors, and caregivers. I wish to extend a warm welcome to all of you attending virtually from all across the province. Thank you for joining us here today. We're pleased to have three experts joining our webinar today to share important information. I'm pleased to welcome Phil Rowe, Assistant Fire Commissioner with the Ministry of Municipal Affairs, Maya Filipovich, Manager of Strategic Partnerships and Public Education with the Alberta Emergency Management Agency, and Daryl Gregory, Executive Director of Caregivers Alberta. Finally, we wish to extend a big thank you to CORE Alberta for hosting the session for us. We have Stephanie here as well from CORE Alberta, assisting with tech and virtual aspects of the session. And there are also additional Seniors Division staff in attendance who will share the presentation, the slides that you're seeing up, and we'll be posting important links and information in the chat as we move forward. Healthy Aging Alberta has built this fantastic platform called CORE Alberta to bring together senior serving organizations and individuals so that we can provide information on issues that are important to helping seniors in the province. And in this case, helping them to live safely in their homes and communities. Healthy Aging Alberta and CORE Alberta works as a provincial network to support the aging population. So before we go further, we wish to acknowledge that although we join from across the province, we are presenting and working on the traditional homeland of the many diverse First Nations, Métis, and Inuit people whose elders have walked this land before us, and those persons with whom we share this great land today. Next slide. So just a few housekeeping items before we get going. In order to streamline this session, questions will be asked using the Q&A feature throughout the session. We will have dedicated time at the end of the presentation to answer some questions. So for this session, we're treating it like a webinar. So participants, all of you, you're all muted and your cameras have been turned off. What you hear in terms of my voice is the volume of the presentation. So you can turn automatic closed captioning on using the feature at the bottom of your Zoom screen. The chat is disabled for participants, so you're not able to use the chat function, but hosts will use it to share important links and information with you throughout the session. The session is being recorded and will be able to be replayed through CORE Alberta and their YouTube channel. No personal information from any of the attendees will be visible in the recording, and the Q&A portion of this webinar will not be recorded or included in the recording. So here's our agenda for the day. We're going to start off talking about fire and life safety. Then we will be discussing emergency preparedness with the AEMA. Then we're going to discuss caregiver considerations. And at the end, we'll have some time for Q's and A's using the Q&A feature from our subject matter experts. So I'm now going to hand it over to Phil Rowe, Assistant Fire Commissioner, to kick us off. Phil, please introduce yourself and I'll hand it over to you. Thanks.
Thanks very much, Jazz, and welcome everyone. And thank you for taking time out of your day to take in and listen to some of the information that we have to provide. As Jazz said, I am the Assistant Fire Commissioner with Municipal Affairs in the Government of Alberta. I have a little over 36 years in fire and EMS experience and emergency management. And I've dealt, a lot of that career was in the public education and life safety area. So this is I'm very passionate about fire and life safety, and thank you to the Seniors Division for letting me take part in this. It's been a great opportunity to work together and have these presentations this week. And there's a lot of opportunities for some great growth as we move forward. So I will go on with the presentation. So we are currently in the midst of the Fire Prevention Week 2024. This is from the NFPA, which is the National Fire Protection Association. They are a governance body that basically in Canada and the United States and Mexico, we follow their lead. They have standards. They carry a lot of things in fire and emergency services. And this is their theme for this year is smoke alarms make them work for you. Over the past many years, it varies from cooking safety to the Great Escape, and smoke alarms is usually a very big one for them. And again, make them work for you is this year's theme, because while smoke detectors are great, if they're not working, then they're not doing what they're supposed to be doing for you. The risk, the most at risk for death in home fires are seniors. There's many reasons for this, to which we'll discuss later. And as you can see in this graph, 65 to 75, the fire deaths are increased, whether it's with alarms not with no alarms and not working, or alarms present and operated. And again, there's many reasons for this that we'll discuss as we move on. Fire causes. There's a lot of detail in this slide, and there is a lot of causes for fires. The predominant ones in structure fires from the NFPA stats are cooking, heating equipment, electrical lighting, intentionally set fires, smoking materials, and candles. Cooking is by far the leading cause of home fires, followed by heating equipment, electrical and lighting fires. Now, this comes into where we're talking about the electric blankets, space heaters. They can fall into them as well. Smoking materials. While smoking is not as predominant as it was many years ago, it is still happening, and it is still causing fires and fire deaths, as well as candles. Cooking is also is one of the leading causes of fire injuries and burns, and very specifically in seniors and very young children. So something to keep in mind. One of the things that we've also been discussing is one item is the introduction of hoarding, which is becoming, well, it's not a cause of a fire. It certainly is hindering the ability for people to escape properly. And we'll be talking about escape planning. So we've had some good introductory discussion this past week about hoarding and how we can recognize that in our senior population. The NFPA calls to action in 2024. Again, it's about smoke detectors, making them work for you. And there's three components to this. First of all, it's the installation. They need to be installed, and they need to be installed properly. We've had some discussion about where smoke detectors should be installed, and we get those nuisance alarms, the ones that are right in the kitchen, or ones that are right outside of bathrooms. Installation, there should be one in every sleeping area, and at least one on every level. This is why it's important to have one on each level. You may have people who sleep in basements, on a main floor, an upper floor. It's critical to have them because the majority of fire deaths, and when we in our service, when we look at, the causes of fire injuries and fire deaths, a lot of times it is at the off-peak hours when people are sleeping. Can they hear the alarm? Is it in the right location? Do they know what to do? So those installation of the smoke alarms is critical. Testing of smoke alarms. Testing needs to be done on a monthly basis. And to this group, the seniors can speak with caregivers, family, friends, and talk to them about how to test smoke alarms, because we have been discussing that, we don't want seniors and people with mobility issues standing on chairs to try and reach their smoke detector. So there are some ways using a broom handle, but again, having somebody that can come into their home and do a test for them, that's a great opportunity as well. And also replacing your smoke detectors. Smoke detectors, whether they're battery operated or they're hardwired, they have a shelf life of 10 years. The manufacturer date is generally on the back, that you don't normally see until when it's installed. But we recommend that people, especially seniors, when they are installed, right with a felt pen or on the front of the smoke detector, what the manufacturer date is, or when it should be replaced. And it's just a good reminder. It's a good reminder. Changing batteries annual is another function that we look at. We can do this in quite often. You'll see change your clocks, change your batteries as a annual campaign. That we in the service, we've actually, especially with seniors, we've looked at, if it's grandma or grandpa's birthday, or there's a festive occasion where everybody gathers at the house. This is a great opportunity to test the smoke detectors, replace them if needed, change the batteries, do your emergency plan. These are great opportunities to make this happen. Nearly 3 of 5 estimated home fire deaths happened with no smoke alarm present, or there was a non-operating smoke alarm. Again, you can see the stats below. I won't go into all the detail of them, and automatic extinguishing systems. When we talk about seniors living independently, whether it's in their own home or they're in a facility, the facilities obviously have better access to other extinguishing systems, automatic alarm systems, where an individual private home may not have those opportunities, although they are there. When we talk about non-operating things like, the battery or the wiring was disconnected. We see this quite often where, the battery needs to be replaced, and rather than replacing it, it just gets removed and I'll do it later, and it doesn't get changed. And we've found this a lot with the nuisance alarms. If they're continuously going off, there's a reason for that, and that reason needs to be fixed. And again, that might be poor placement of the alarm, so it should be moved. Okay. Fire is fast. You have really less than two minutes to get out safely once the smoke alarm sounds. Working smoke alarms give you that early warning so that you can get outside quickly. Again, this will tie back into your fire escape plan and emergency planning. But the key message here is, when you hear the beep, get on your feet, react, do something. Don't just sit back and assume that the fire alarm, that it's just a false alarm or it's going off for some some other reason. If it goes off, react. Some do's and don'ts. Do check your alarms monthly. Change the batteries when changed in the clocks or some other occasion around, throughout the year. Say it doesn't have to be that specific time, but something that will be a good reminder to change those batteries. Keep your alarms clean and free of debris, so you can get the dust bunnies, and we want to keep that sensor clean because that's what's going to recognize the smoke and uh, alarm so that you can hear it. Instruct your household what to do in the event of an emergency. Know what the beeps mean. So again, when you test it, you'll hear what the smoke detector sounds like. If it just beeps intermittently every once in a while, that's generally a battery issue, or it's a functioning issue that needs to be rectified. And do install smoke alarms throughout your home on each level, and preferably in each sleeping quarters. Don't remove the alarm due to cooking or shower incidents. So we talked about the placement of alarms. If it's going off, we should have that smoke detector moved into a proper location. Don't cover or paint over your alarm. We've seen many instances where the alarm is covered with a shower cap or a bag so it doesn't keep going off. Well, that's your life saving, and we don't want you covering it up. Don't remove the backup battery. Don't rely on an outdated smoke alarm. If it's over 10 years old, have it replaced. Don't replace interconnected or electric smoke alarms with a battery operated unit. And interconnected means that, and this is new in building and fire codes, that houses are interconnected. So if the basement one goes off, all the alarms on each level, every alarm will go off to indicate that there is an alarm somewhere in that building. So do not replace that interconnected one with a battery unit. Some essential home fire safety equipment. Again, smoke alarms on every floor. Carbon monoxide detectors are great great unit to have. And these are generally they can go hand in hand with conventional smoke alarms. They can be standalone units, and generally by heating equipment, so your furnace, anything that gives off any natural gas, you want to have a carbon monoxide detector near. Fire extinguishers. Fire extinguishers are great tools, only if you know how to use them and how to get them. And in my career, I've seen many instances where people have had smoke detector or fire extinguishers, but they're under a cupboard, under the sink, behind a whole bunch of things. It has to be somewhere readily available. Generally, what we do is we tell people to put them by an exit, because ultimately what we want people to do is we want you to get out of your residence, and at your exit, if this fire is small, you know how to use a fire extinguisher, then you grab the fire extinguisher at the exit and you walk towards the fire, try to put it out. Again, we want you to still leave and call the fire department so that we can ensure that it's out. Fire escape ladders. So if you're in a multi-story home or apartments, these are great tools to have. Again, there with it comes awareness and operations. So when you have a fire escape ladder, you have to be able to know how to use it. And in the event of a fire is not the time to learn how that thing works, because it is really a collapsible rope ladder. Do you have the ability, the strength, the mobility to be able to access this fire escape ladder? So again, these are just part of tools, other tools that are part of a greater fire escape plan. There's other systems. We'll skip those ones. Escape plans, and this is critical to your safety. And to everybody's safety, whether it's a senior, whether it's a family. Ensure everyone in your household knows what to do. Identify two ways out of every room. Uh, and one item that was brought up in our Edmonton session, which I found was really great, was when you're planning and practicing your escape plan, plan it to your mobility. So if you have mobility issues, you have hearing issues, vision issues, check that plan, develop it, and practice it so that you're ultimately testing your mobility issues so that you know that the plan works. Ensure that doors and windows are easy to open. Again, if the secondary exit is your window, that's not the, in a fire is not the time to check to see if your window opens. And these are things just on a routine basis. If you get in the habit of checking this, where how to access your doors. Do walkers and wheelchairs, do they fit through doors? The fire is not the time to figure that out. Again, windows, making sure that they can open. Where's a designated safe place? Most community or seniors facilities will have designated meeting spaces. The seniors that are living independently in their own homes, do they have a meeting space? And one thing that we always discuss in our neighborhood is if the fire happens in January, where can you go in the middle of the night? Whether it's a neighbor, somebody that you can stay safe and warm and get 911 on route. So we don't want families or seniors standing out on the side of the road at -30 during a fire. So find that safe designated meeting place. Again, practice that escape plan regularly, including at night, because the majority of fire deaths we find are happening at night. And when people are trying to wake up, drowsy, groggy, tired, and being able to almost alertly become alert so that you can escape properly. Include plans for evacuating your pets, service animals. That should all be a part of your plan development. And anyone that is staying in your home, make sure that they are aware of your plan. So if you have guests over, you have family over, practice with them. And we've always liked the opportunity, again, when you're having a Thanksgiving dinner or grandma or grandpa's birthday and everybody's getting together. And if they're staying the night, what a great fun way to have an escape plan. Kids love it, and the seniors get to execute and practice their plan with family. Some other considerations for seniors: mobility, hearing, and vision. We've talked about that. If these are one of the things with the testing of your alarm. If you have hearing issues with your hearing aids are out at night, can you hear that alarm? Do you sleep with with eye covers? Are your windows fully closed? The mobility challenges. Though when that alarm goes off, you have to be able to hear it. There's strobe lights on smoke detectors now, so for people who have hearing challenges, that the bright light, and it's a bright light that goes off and to wake you up. Green sleeve emergency documents, these are critical. Do you have this information at hand? And we always talk about having a go bag, so something readily available. This isn't a massive suitcase. It's something just quick. Contact information, your prescription drugs. Do you know where they're at? Contact list for families. Specific medical equipment that you need. Asthma, oxygen. Do you have that ability to grab that and get out. And again, this is all within 2 minutes of waking up from that alarm. The assigned roles. What is everybody's role? Now we get in, especially when we get into the seniors accommodation, living and housing. What is everybody's role when it comes to fire safety? And everybody should know their role. Repetition and routine. Again, the more you do it, the more you try it, it becomes natural. And kids do this in school. They have to do 6 a year. I know in a lot of seniors residents, they do these monthly as well. That's that repetition and routine that you just get to understand, exactly what to do. If you are in a seniors facility, we encourage to try and switch things up. Throw some little tidbits in there, like this route is blocked, and what would you do? And these are the times to try this, that so that people your residents get accustomed to identifying the changes, and they know what their second route out. Keeping it simple. Don't overcomplicate things. Get people out to safety. Call 911. Get professionals on the way. Even when the fire smoke alarm goes off, even if you think it's small, get the fire department there to ensure that it's out. The biggest thing is, let's get our residents, get our seniors out to safety, and get the professionals on the way. Don't wait. Environmental clues. These are things that we've talked this week about. Do you recognize some cigarette burns, or are there things that are the starting of hoarding? Little things that are triggering off. That it could be a caregiver, could be a friend. If you notice something that doesn't look normal, we need to address it. And how we address that, we'll get into that further. Caregivers Alberta has some great opportunities with that, but don't leave it alone. Make sure, because this is their safety. If we're seeing things, let's address it. The assistive technologies. There's a lot of new things being generated out there. Again, automatic shutoffs for stoves. There's fire alarms that can actually attach to a bed frame that creates a vibration. So again, this all in part and parcel is in your fire plan, which when you develop it and test it, if things aren't working, that needs to be addressed. And there may be some technologies that are available that can assist in that plan. And before we go to this, there's going to be some resources and some links at the end of this, I believe, that the staff are going to present. NFPA has a lot of good information for seniors and for caregivers, and I encourage everybody to go to that link, as well as the Alberta Emergency Management Agency, Caregivers Alberta. Visit those links and find the information that you need to keep your seniors safe and healthy and protected. Thank you.
Thank you, Phil. That is really, really great information that you've just provided, and important. It's important information, and it's full of useful and practical advice for people to be able to implement in their homes and with those and their loved ones. So I'm actually looking forward now to the Q&A, because I'm sure there's going to be a lot of great questions based on the information that you just provided. So thank you. And now it is my pleasure to pass it over to Maya Filipovic from the Alberta Emergency Management Agency to share some information on emergency preparedness. So Maya, please go ahead and introduce yourself, and over to you.
Thanks so much, Jazz. An excellent pronunciation of my last name. I'm very impressed. Hi, everyone. Like Jazz said, I am Maya Filipovic. I am the Manager of Strategic Partnerships and Public Education. We are also known in slightly broader terms as the Be Prepared team. So we are a team within the Government of Alberta's Alberta Emergency Management Agency. And I am here today to talk to you about emergency preparedness. So while the focus of today's session is predominantly on fire safety, when my team looks at preparedness, we take an all hazards approach. So whether the hazard in question is a fire or a tornado or severe weather that causes a power outage, today's information should better prepare you for anything that could happen in your community and your home. So a little bit more about the work our team does for context. We focus on preparedness at the individual, household, and community levels with a goal to increase disaster risk literacy and encourage disaster risk reduction actions in Alberta. In other words, our goal is to encourage a culture of preparedness in the province. On the screen here is a screenshot of our Be Prepared Hub. This program has 19 web pages on alberta.ca, and that number continues to grow as our program expands. Materials are translated into several languages, and content is developed to cover a range of hazards. There is a long list of programming planned, and we have an ongoing effort to make preparedness information accessible, especially for those people who need it most. Our program is informed through research and by partnering with subject matter experts to ensure that our materials can be a source of truth for Albertans to use. We create programming that is easy to understand and share, and conduct year-round engagement, such as this session, to build capacity for public education at the local level. So everyone has been impacted by an emergency, a disaster, or a disruption in some way, shape, or form. These events can happen suddenly and often without warning, causing devastating impacts that can last long after the emergency is over. Aging adults can be especially vulnerable to these types of situations due to their increased need for support, such as mobility assistance and various medical needs. It's vital for individuals to actively plan and prepare for potential emergency events to minimize the impacts that they might have. By having preparedness measures in place, individuals can ensure access to necessary resources like medical supplies, mobility kits, mobility aids, and communication tools are available. Effective planning also helps the community or organization cope with disruptions and accelerate recovery by facilitating quicker access to those emergency services and supports. So to be prepared, you need to know what to do, where to go, and have enough supplies for at least 72 hours. We know from our research that there are a lot of reasons why people don't take preparedness action. It can be daunting and you might not know where to begin. Breaking preparedness down into simple steps can make the process more manageable and help you be prepared not just for fires, but for any kind of hazard that can happen year-round. Preparedness is personal, so the steps you take will vary from those around you. Many of you might be familiar with the phrase, know the risks, make a plan, build a kit. But through our research, we've identified additional preparedness behaviors that are integral to a person's resilience to disruption. Additional behaviors include getting informed, creating financial resilience, which is about more than just having money in the bank. Insurance is a great financial safety net too. Making community connections, because we know that having a strong network around you is a predictor for resilience. This is a low-cost action that wouldn't be held back by affordability issues as well. We also encourage folks to start a conversation with their networks, which will help take the stigma out of preparedness. Preparing in advance can keep you safe and comfortable and help you get back to your normal life more quickly. It also helps others because emergency responders can focus on helping those who need it the most. Alberta's diverse landscape and weather contributes to a wide range of hazards, such as extreme temperatures, tornadoes, wildfires, blizzards, flooding, and more. Identifying the hazards near you and understanding your risk to them is an important step to being prepared, so you can better navigate disruptions when they occur and return to normalcy. Hazards vary depending on where you live. So think of where your property is located. Are there ponds or sewer drains that flood every spring? Do you live near a wooded forest or ravine that has the potential to catch on fire during the summer? Or maybe you live next to a rail line and there's a potential for an accident or a hazardous spill. Once you identify the risks in your community, you can make a plan to prepare for those risks. So I know it's quite small to see, but the timeline on your screen is a great visual of how major disasters, and particularly wildfires, are increasing year over year. As you can see, between 2003 and 2023, 2007 is the only year where nothing major has occurred. This trend underscores the growing need for preparedness, especially for vulnerable groups like older adults who may face unique challenges during a major event. The URL on this slide will take you to our hazard pages. We have dedicated web pages on flooding, power outages, blizzards, extreme cold, tornadoes, extreme wind, thunderstorms, heavy rain and hail, wildfires, extreme heat, and water shortages. Our team is very busy. Each of these web pages also link to a fact sheet on the hazard, which is available in 10 different languages and for print. So making an emergency plan can help in times of confusion and distress. These emergency plans will differ from person to person, so ensure that you make a plan that works for you and your unique needs. Caregivers are in a unique position to provide support to seniors regarding physical health. They also know who may need extra assistance to prepare for potential disasters. So Phil touched a bit on this topic already, but there are a few more things to consider as key elements in an emergency plan. So for health, you'll want to familiarize those involved in your emergency plan with your medications, medical supplies, and devices, and make sure they know where they're stored. For example, a medical passport, commonly referred to as a green sleeve, like Phil mentioned, should be stored on or near the fridge for emergency services personnel. For communications, you'll want to create a communications plan that will outline who you will contact and who will check in on you during emergencies. These contacts may be caregivers, loved ones, or community-based organizations and agencies who serve seniors. And just for awareness, communication systems can often become overloaded and unavailable during emergencies and disasters. So it's very important to have a backup communication method identified as well. For power dependency, if you use medical devices, equipment, and medications that rely on power, you'll want to consider looking into backup power supply options if your need for power is essential. So think about how you're going to store medications that require refrigeration if there's a power outage. For sheltering in place, you'll want to identify safe locations to take shelter for varying hazards that will keep you and your pets or service animals comfortable for several hours or days. Also ensuring that there is room for you, your emergency supplies, and essential medical equipment. You'll also want to make sure you're performing routine maintenance. So consider performing routine maintenance on your home so that it can withstand severe weather. Check that window caulking and seals are intact. Renew insulation, keep downspouts and gutters clean, and consider installing a sump pump. And then for evacuating, fire departments, police, or your local authority may issue an evacuation message such as an alert or order when they have reason to believe that you're in danger. So you'll want to ensure that you have a location that you can evacuate to and reliable transportation to get there, keeping in mind any mobility limitations. And your community may arrange transportation for evacuees depending on the scale of the emergency, but it is always wise to have a backup plan. And similar to the other URL on the other slide, the link on the previous page, this page right here, will take you to a web page for more information about how to make your own plan. So another step to take on your preparedness journey is knowing where to access information in your area. This is key to making informed decisions during stressful situations. Directions from authorities vary on the emergency and change as the situation unfolds. So find out where your community will post information and updates during an emergency and then subscribe or bookmark them to stay informed. In the event of something like a fire, be prepared for first responders to directly tell you what to do and where to go. For larger scale emergencies, there are a few resources to help you stay informed with relevant and timely information. The first one is the Alberta Emergency Alert System, which is a public warning system in Alberta that warns the public on impending or occurring emergencies affecting an area. These alerts provide critical information about actions individuals should take where there is a threat in their area, such as wildfire, drinking water advisory, civil emergency, or a tornado warning. Alerts are distributed through the Alberta Emergency Alert app, radio, television, and road message boards as well. The Alberta Wildfire app allows you to see where wildfires are burning in Alberta, which can help you make informed decisions, especially when it comes to planning trips. And then lastly, Alberta 501 is a great resource to access for your local road reports, including road conditions, road closures, the status of traffic, and road incidents. One preparedness behavior we know that many struggle with is creating financial resilience, and especially in today's world with everything costing more and more. But there's a great quote I heard the other day. It was, "Save money because it will save you." And it's so true because emergencies, disasters, and disruptions, big or small, can be costly, with impacts lasting months or even years after it occurs. An emergency savings account can cover these unexpected expenses or be used for insurance deductibles if making a claim. But having an emergency fund is just one way to build financial resilience. Other things you can do to be prepared include understand, review, and update your insurance policies each year to ensure that you are covered for the hazards in your area. You'll want to keep cash on hand in case banks and online services are impacted by the event. You can install antivirus software on your tech products like computers, cell phones, and tablets to prevent hackers from stealing your passwords, identity, and other important documents. You can prepare a detailed list of all of your belongings in case of a flood, fire, or break-in. And just know the signs of phishing scams. You'll never want to provide any personal information over the phone, through email, or to door-to-door visitors that you are not able to verify as legitimate organizations. And as we know, older adults are often targeted during these events, increasing the risk of financial scams. One of the most common ways people prepare is by building an emergency kit or purchasing a 72-hour kit because it's a tangible way to see and feel prepared. If there is a fire in your home, building, or neighborhood, you will likely be required to evacuate. Having a grab-and-go kit already prepared means that you don't have to think about what to frantically grab in the moment and ensures that you will have what you need with you once you leave your home. On the other hand, you may be required to shelter in place. This can happen if you live in a high-rise apartment building. A fire on one floor may mean that first responders only evacuate certain floors. Or there could be a tornado warning or a power outage, which would cause you to need to shelter in place. So having supplies for a minimum of 3 days ensures that you can remain safe and comfortable while that hazard passes. These actions are essential to being prepared and building self-reliance. Emergency supplies should always include food, water, medications, and important documents. And as I mentioned earlier, preparedness is personal and unique to everyone. So there's some additional considerations to keep in mind when building your kit. You'll want to consider packing extra medications and medical equipment supplies, such as incontinence undergarments, catheters, syringes for insulin, feeding tubes, that sort of thing. You can make copies of important documents, including prescriptions, and keep those in a waterproof bag. You can keep spare items such as keys, glasses, and dentures with your kit or in a safe space in your home. And then another consideration is getting ice packs or a cooler for refrigerated medications and extra batteries for hearing aids or other devices such as wheelchairs. Ensuring you have the necessary supplies readily available will keep you safe and comfortable and allow you to better cope and recover when faced with an emergency event. For printable emergency kit checklists, you can visit the link at the bottom here. These checklists are also available in translated versions. Starting conversations with your community, family, neighbors, and caregivers about potential risks and impacts is a vital step in fostering preparedness. Senior centers, family and community support services, and community organizations provide opportunities to have coffee and chat sessions where emergency preparedness can be a topic of discussion. In many cases, you can ask your local seniors organization to host information sessions to facilitate conversations and provide support. Discussing these topics can spark action and encourage everyone to come together to develop strategies and resources that enhance collective readiness. The last point to make is making community connections. So you'll want to start preparedness conversations with those around you. That will also help you make those community connections. You can take steps to get to know people around you by waving a friendly hello, joining a local community association, committee, or group program. And once you've built that support network, you can identify those who would be willing and able to help you and those to whom you could offer help as well. When people work together, it can really reduce stress and recovery time. Here's a quick 60-second video with some additional tips on creating community connections.
in your community help you become more prepared? Neighbors are often the first to lend a hand when an unexpected situation occurs. Knowing your neighbors makes it easier to ask for help when you need it most. There are lots of ways to safely stay in contact with those around you. Smile and wave or say hello the next time you pass someone in the street. Go online and join community groups that interest you. There are many online options that connect you with your neighborhood. For example, plan a simple event like a window decorating contest. Or build a community email list so you can check in on each other. Connected communities are more resilient communities. How many people do you know in your neighborhood? For other ideas on how to build resilience, visit alberta.ca.
So
How does knowing your community
if you visit the link at the bottom of the slide there, you'll also find a variety of other videos and a ton of resources to support you on your preparedness journey, wherever you might start it.
help you become more prepared?
The video just keeps wanting to keep playing. Okay, that brings me to the end of my presentation. If there's one thing you take away from this session, it's that we are all impacted by hazards, but taking one small step a day can help you build habits so that you can be resilient year-round. Don't wait until an emergency occurs to try and stay prepared. So start a conversation, build your emergency kit, make a plan, and take those proactive steps to ensure that you and your loved ones are ready. And like I mentioned, our program has tons of resources available to support you. If you have any questions or you want to stay informed on our program, you can also email us at the email on the screen there. Thank you so much, and I will pass it back over to Jazz.
Thank you, Maya. Again, that was really, really great information. And again, very, very practical tools and tips to help people be prepared in their own homes. In your presentation, you talked about for any emergency, which is great, which includes fire events as well. So really great information. Thank you. And for all of you online, if you have any questions or comments for either Phil or Maya so far, please post them using the Q&A feature in Zoom. So before we introduce our next speaker, I'd just like to flag another way that communities can be prepared. This is by having a vulnerable persons registry in place. A vulnerable persons list or registry, it's a locally led initiative that allows individuals who may need extra assistance during an emergency to register with their municipality. So for example, the regional municipality of Wood Buffalo has a vulnerable persons registry, which they have actually utilized since 2018. It's been used to assist vulnerable persons during a number of emergencies, including, well, you saw some of them on Maya's slide, flooding, fire, evacuations, and the pandemic. So in the regional municipality of Wood Buffalo, the municipal fire chief oversees the VPR, which is the Vulnerable Persons Registry, for the municipality. And then first responders are able to pull up a map of all registrants during an emergency and prioritize rescue by the type of vulnerability and the type of emergency. So when someone registers for the VPR, they receive a visit from local officials and they're given a bag, like a swag bag, of emergency preparedness items. So everyone on the VPR list is contacted annually as well to ensure that their information is kept up to date. So the VPR, the Vulnerable Persons Registry, it's typically available to residents who experience mobility issues. So Phil talked about that in his presentation, visual or hearing impairments, developmental disabilities or cognitive impairments, challenges perhaps related to mental health, individuals who require electricity for life-sustaining equipment, so things like an oxygen tank or dialysis or even life support, and temporary limitations, so due to illness or recovery from a surgery, say. So it's a relatively newer initiative in Alberta that municipalities can consider implementing in their own communities, like the regional municipality of Wood Buffalo did. And it's not to be confused with the My Alberta Emergency Registration System, which is, Maya talked about, which lets you register provincially for emergencies that may affect your household. So we will be sharing a link in the chat where you can find more information about the Regional Municipality of Wood Buffalo's registry and explore opportunities for similar initiatives in your own community as an idea. So with that, now I'm pleased to pass this over to Daryl Gregory to talk about caregiver perspective. So Daryl, I'll pass it to you and you can introduce yourself and over to you. Thanks.
Thanks so much, Jazz. I'm Daryl Gregory, and I'm the Executive Director of Caregivers Alberta, a role I've been in for a couple of years now. Prior to joining Caregivers Alberta, I was an Executive Director with the MS Society of Canada for 15 years in Edmonton and Calgary. So I have over 20 years of nonprofit leadership experience serving vulnerable populations. So I do want to thank you, Jazz, and your team for inviting Caregivers Alberta to this conversation. This is not a conversation in which we are currently participating in any strategic or intentional way. We do several education events throughout the year, from legal concerns that caregivers have, palliative care, wellness resources, and respite, and several others. I can say with certainty that none of those education events addresses fire safety. And that probably is one reason why we don't have a slide deck for this presentation. There are several opportunities for collaboration to address this important issue, and I am looking forward to seeing how we can continue to work with partners, some of whom are in this webinar, to help caregivers create safe homes for their loved ones. Caregivers play an important role in enabling their loved one to remain in their place of choice, which for most people is their family home. Family and friend caregivers take on many responsibilities to ensure their parent, their spouse, their child, their friend and neighbor has quality of life that most of us take for granted. That quality of life includes being safe and secure in your own home. When caring for an aging parent or an aging relative or friend, there can be unique challenges that we want to be aware of so we can take appropriate precautions. I'm going to put a personal lens on this now and share some personal perspectives from my experience caring for my aunt, who is 89. This is my lived experience, which is not unique. I think about the things that will make it impossible for my aunt to continue living on her own. What will be the tipping point for her? It seems to me that the highest risk factors are either a bad fall or a fire. She fell a couple of weeks ago. For some reason, she likes to keep the door from the house to the garage open. Don't ask me why. On this day, when I was at her house, she put a board across the bottom of the door so the mice wouldn't get in the house from the garage. I was doing something in another part of the house and I heard a loud crash. I knew it didn't sound good. Sure enough, she didn't notice the board that she had put there, tripped over it, and was lying on the small landing into the garage. Fortunately, nothing serious had happened. I share this to demonstrate her state of mind and her cognitive abilities, which have changed noticeably over the years. Her story is not unique. We heard a few things from Phil regarding the safety precautions that seniors can take when they are doing things in their own home, when they are alone. They often don't do things the way that most of us would, which is a reflection of their declining cognitive abilities that we as caregivers need to watch out for and be aware of. So we were lucky that time. However, there are other risk factors that I think are much more dangerous than a fall, not just for my aunt, but many seniors. Continuing with my own experience, this is what I see and hear when I visit my aunt. She is often cold, so that means there are a lot of space heaters in her home. She turns the oven on because she's cold in the kitchen. Did I turn the curling iron off? Is a question I hear often from her. And to make matters worse, she is stubborn. She is an old Saskatchewan farm girl. She has a lifetime of doing things a certain way. Why should she change now? So her reasoning goes. I know the stories. As she ages, I hear them more and more. I hear the stories of her life on the farm. I hear the stories of her riding to school in the back of a horse-drawn wagon in the middle of a prairie winter. She is not going to be cold anymore. She is done with being cold. If that means another space heater in another room, that's what she's going to do. There are fire risks generally for seniors about which we as caregivers need to be vigilant. What if someone puts food on the stove to cook, has a fall, and they can't get up? What happens if a candle is lit and accidentally falls on the floor without anyone noticing? What happens if a shirt gets thrown over top of a lamp, a space heater, or electrical socket? As caregivers to those we love, either by choice or default, we can help mitigate risks. We have influence. Family and friend caregivers play a safeguarding role. Let's be aware of the risks. Let's talk about them with our care recipients. Let's talk about them with our caregiving team. This can include home care staff, and in my case, my cousins, who share the caregiving responsibilities of caring for their mother and my aunt. Even when people are relatively independent, fire safety can still be a concern. It is common for people to want to hold on to their independence as they age. This can lead to a reluctance to relocate to a safer environment or with a family member. We don't want people to worry about us unnecessarily. That is human nature. We think we are protecting people from worrying about us by not mentioning the bad things that happen. I don't want to tell my children because they'll get worried for nothing. It is important for the caregiver to look around the kitchen for signs of burnt items, pots and pans, plastic utensils, plates. Check that heating vents and electrical outlets are not covered with flammable items. Check furniture and carpets for cigarette burns. This is one more thing for caregivers to add to their routine when visiting their loved ones. Be watchful. There are often signs. And tell your home care staff as well. If there is one thing in particular that you're concerned about, it won't take home care long to take a quick look. Our caregiver coaches regularly hear about a care recipient who is living alone or is alone for long periods of time. Fire safety can be a concern in these situations. For example, this could be from adults who smoke and may have an illness or disability that could cause them to drop or neglect a cigarette. Use of the stove for someone living with dementia, forgetting they have put food on the stove or in the oven. Some alternatives include unplugging the stove and oven and instead using microwave-friendly meals such as frozen meals or a meal service. There are also stove cutoff mechanisms that can be installed to automatically turn off an appliance. Have frequent check-ins through the time periods they are alone. Home care check-ins can often help in this regard. Utilize the other community resources to be an extra set of eyes and a safe place for your loved one to seek help if needed, such as home care staff, community-friendly visiting volunteers, Meals on Wheels delivery drivers, neighbors, and friends. It is important to remember individuals don't generally burn things on purpose. For seniors with dementia that still live alone, the home can be a very dangerous place. That's because dementia not only causes memory loss, it can also disrupt parts of the brain that control reasoning and problem solving. As a result, one of the biggest risks facing an elderly person with dementia is fire. If you're taking care of a senior with dementia, fire safety might be near the top of your list when it comes to caregiving concerns. We heard lots of strategies and safety checklist items from the fire experts today. Phil, you mentioned having caregivers, family, or friends play a role in changing batteries and other tasks that the senior living alone cannot easily and safely do. That's a fantastic idea. When there's a family event where people are gathered at Nana's or Grandpa's house, let's have a checklist and get those things done by people who can do them while enjoying social time together. Maya, you talked about developing community connections. This is also an excellent idea. Caregivers, do you know the neighbors who live across the street from your care recipient? The connected community is a concept that we need to explore as an added safeguard for our seniors. As a matter of fact, connected community is a theme at our conference in November, where we are exploring how we can identify and mobilize assets in your community wherever you live in the province. Caregivers are one part of a holistic approach to fire prevention. It is a shared responsibility that requires collective action. Caregivers are often the first and last line of defense in the well-being of their care recipient. They are often the difference between a loved one being able to remain at home or having to go into hospital or long-term care. It is the same with fire prevention. Through education and awareness, we can make homes safer for Alberta seniors. And that concludes my presentation. Thanks so much for the opportunity.
Thank you, Daryl. Really, really great information. And thank you for sharing the information about your aunt in terms of a very, again, very practical example of how important this conversation is today to ensure that we are having these conversations with our loved ones as well. So I'd like to say thank you to you, Daryl, to Phil, to Maya, to all of our great presenters today. So in summary of all of the discussions, just, this slide that you see up, it's just some quick tips for how we can help to promote fire and life safety for older adults. We've created 2 handouts that you can print and share, and the links are being posted in the chat. I do want to acknowledge that we're 2 minutes over time. So just really quickly, I'd like to say that, everyone can help to spread the word about fire and life safety. And there's a few things you can do. So you can print and share the resources that we've mentioned today. You've been receiving links throughout the session. If you're a service provider, you can have them on hand in your office or near your distribution materials. Consider connecting with your local officials to have a speaker come and discuss fire and life safety and emergency preparedness with a group of seniors. If you're going into a senior's home, keep an eye out for fire hazards. If you see something, use the opportunity to provide some gentle education on fire safety or refer them to a local fire safety resource to get assistance, fire department. So as a service provider, you're obviously not going to be in the seniors' homes pushing their smoke alarm or their test buttons, testing out the batteries. But with a family or friends, of course, there's that opportunity. Maybe some of you are going to your elderly relatives' homes for Thanksgiving this coming weekend. And that, just give that button a little push on the smoke alarms to test out the batteries, see if they're working. Have crucial conversations with loved ones about fire safety in their home, and even practice putting together and executing an evacuation plan and escape plan, as Phil talked about and Maya did too. Some municipal fire departments offer voluntary fire and home inspection, so you can check in with your local and see whether that's something that's offered. So with this, I think I'll just say thank you to all of our presenters for the excellent information that you've shared today. This is a huge topic, and we've really just scratched the surface this Fire Prevention Week of 2024. On this slide are some links to resources that were discussed today. These links have been put in the chat as well. And I thought we would have some time for questions and answers, but I don't think that we do, as we're already 4 minutes over. So I would just like to say thank you to everyone who joined us today, and as well everyone in the future who will join us as well, because this session is being recorded and will be viewable at a later time. We hope that you've had, now you have some helpful takeaways on seniors fire and life safety from today's session. And with that, I think we will just say thank you and goodbye.